it's unnecessary stress for a mom to also be contending with glucose variability that hasn't been explained to them based on if you're taking more of this hormone than normal, we expect you to be more insulin resistant. If you're
Mhm.
taking more of that hormone than normal, we expect you to be more insulin sensitive. And
Right.
from our clients, that's one of the things that I think we've both heard a lot is just having these types of conversations and really drilling down into their specific IVF plan and what the expectations are with what's coming next. And then when they are, say they've retrieved the eggs, let's say we're at that stage and now we're
Right.
getting ready, we're prepping the uterus. We aren't, right? But they are.
No. Right.
And their team are doing that, not me.
Right.
What can we expect with diabetes management? What do we need to change to help support their
Yeah.
ability to manage their diabetes in an excellent way?
Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Hello, and welcome to another wonderful episode of Think Like a Pancreas, the podcast. Tavia, Vital, and I are here to talk today about really, really important things for women in a specific time of life. And as we both work with women through preconception planning and pregnancy navigation, and even in the postpartum time, our goal today is to talk about IVF and insulin requiring diabetes, kind of a overview of what to expect and why support, like the support that we bring from Integrated Diabetes Services, is so valuable as you navigate this road to bringing another little person into your family. As I said, I'm here, Jennifer Smith with Integrated. I'm the Director of Lifestyle and Nutrition. And then Tavia, do you want to just say hi to everybody?
Sure. We're glad you guys are all here listening to us today. And for those who haven't heard my voice yet or haven't met me yet, my name is Tavia Vital. I'm a registered nurse, certified diabetes care and education specialist, also with Integrated Diabetes Services. And like Jenny said, one of the groups of people that we get the privilege to work with regularly are moms to be, those who are getting ready to try to conceive, those who are on the journey, those who are just thinking about it, and those who already have been in the, oh my gosh, I'm pregnant bucket and are working with us to help with their diabetes management throughout all the stages of pregnancy. Glad to be here working with Jenny today. This is a topic that she and I have talked about in between visits often because of the variety of challenges that come up with the different types of IVF that are available and how it impacts diabetes over time. I'm excited that we get to talk about this today.
Yeah, I mean, again, goals being to really understand that a lot more women that we've seen in practice, again, our small practice that we have, we've seen a number more of women needing to go the route of IVF in order to start a family or add to their family. And when you have diabetes, there's a almost plus experience to navigating that road of IVF and fertility. So we really just wanted to try to kind of normalize that and also give you an understanding of what is it like? What's sort of the preparation time look like? And then how do you navigate during? We definitely could hold a couple of extra episodes all about pregnancy and navigation once you are pregnant.
Yes.
But really there's a lot to navigate with the different IVF options and the different hormones that are used in order to provide that positive pregnancy test.
And I think
As
it's an important topic for us because living with diabetes, insulin requiring diabetes, and approaching the subject of becoming pregnant, it has its own layer of, it's common anyway, for people to express anxiety, feeling unsure about their ability to manage their diabetes.
Hmm.
as well as needed to have really excellent blood sugar management prior to and during conception. And so then anyone who then is also contending with needing to learn about the different types of IVF, go through the IVF process by itself, it's its own layer of, it's you're shifting hormones. You have this anxiety and this strong desire to become pregnant. It is going to then impact your diabetes too. So it's a lot to contend with. And so it isn't impossible. It actually is very successful for a lot of women, which is very exciting.
Hmm.
And I often hear from our clients that they feel really isolated going through it. So I think that's one of the main points today too, is just to let people who might be going through this or thinking about going through this know that there are other people going through. It might not be the exact same process you're going through, but kind of going through the emotional toil of it and the timing and the number of visits with doctors and so on, and the diabetes fear and anxiety and challenges that come up. So you're not
Right.
alone out there, even though you might be the only one you know. There are many women who are successfully able to use IVF who
Yes.
also live with diabetes and take insulin that
Hmm.
get to the other side and deliver healthy babies, a healthy baby, or maybe they do more than one, or maybe they have IVF therapy over years and have multiple children. I've seen
Hmm.
all of those scenarios happen.
Right. And you said something I think is really valuable in the fact that there are stages to IVF. And
Yeah.
so those stages, as you said, there's a mental navigation. There already is with living with diabetes to begin with. But adding this in, you're looking at not a short time period like 2 days, but you're looking at a progressive nature of the stages of IVF prior to even conceiving. There are multiple steps in the process, and a lot of that you have to be ready to wrap your mind around, and so a really good clinical team is very valuable for you to have for that understanding. A team that can really explain to you, this is where we're going to start, this is where we would expect this to happen and this to happen, and then a team that also understands that you're navigating not only what they're telling you to do, but you're navigating the changes that are going to come with your insulin need. As you said, all of the hormones that are kind of used, we've got so many different, I won't even bring up the names of them because there are so many different types of hormones that you could possibly be using in different stages. Things that help you prevent conception to begin with and get your uterus ready and like get you ready to stimulate and all of that stuff. So they all play a big role in blood sugar management and thus insulin needs. Insulin needs go up, they might go down. You might not have any energy. And so your exercise changes. You know, all of that is relative to your diabetes management. The emotional load and definitely that unpredictability in terms of how you're going to work through this, it takes help from more than just maybe your fertility team. And that's important to realize.
Yes. And I think if you're going down this path currently, don't beat yourself up if your glucose is not as well managed as it was before you started any of the treatments during your IVF journey. But
Right.
do reach out to whoever helps you with your diabetes management. If you don't have someone, then find someone like Jenny and I to help
Mhm.
you because there are strategies that can be implemented that can really help when you have a good understanding of, let's say, you're taking hormones to stimulate ovulation. How might that impact your insulin needs?
Mhm.
You've got it. We have a plan for that. We can help you understand what you'll likely see and
Mhm.
strategies and methods to get your insulin doses adjusted or the timing of your doses adjusted to work better at the stage that you're in of this IVF journey. And
Mhm.
without it, it just it's unnecessary stress for a mom to also be contending with glucose variability that hasn't been explained to them based on, if you're taking more of this hormone than normal, we expect you to be more insulin resistant. If you're
Mhm.
taking more of that hormone than normal, we expect you to be more insulin sensitive. And I just,
Right.
from our clients, that's one of the things that I think we've both heard a lot is just having these types of conversations and really drilling down into their specific IVF plan and what the expectations are with what's coming next. And then when they are, say they've retrieved the eggs, let's say we're at that stage and now we're
Right.
getting ready, we're prepping the uterus. We aren't, right? But they are.
No. Right.
And their team are doing that, not me.
Right.
What can we expect with diabetes management? What do we need to change to help support their
Yeah.
ability to manage their diabetes in an excellent way, in a healthy way? And then what to do when another layer of who knows what goes in. Maybe there's someone who responds the opposite expected way to insulin sensitivity or insulin
Mm-hmm.
resistance. That happens every so often just for fun, where you have the normally women using this go this way and need more insulin, but then we'll have a client that's like a total opposite. Why? Because that's what their
Right.
body is doing, right? I
Right.
think I think having that individualized step-by-step approach and being accessible to insulin needs changing and getting
Mm-hmm.
support to adjust how insulin therapy is given is of utmost importance during this exciting journey, but
Yeah.
also stressful journey if you don't have the right support.
And I think that, as you said, support being kind of a really optimal thing in this whole big picture, because fertility clinics are great. They know what they're doing from the angle of what your goal is and their goal to get you there. But also taking back your plan for whatever type of IVF you're going to go through, long term, more short, more natural IVF. There are, again, lots of different options, but you have to then take that back to your diabetes team and be able to say, this is the plan. These are the hormones we're going to use. This is when we're going to use them. This is the dose that we're going to use. Sometimes there are steroids in the picture. Sometimes there are not. All of these have big impact on blood sugar. I mean, estrogen, yes, it increases, but sometimes it's more mild compared to the progesterone. We've got sometimes there's stress in the picture, and then there's cortisol. Like all these different things that you might be considering. You might also during this time be told by fertility clinic to reduce your your exercise, your activity. You might
Right.
be told to do no more than walking. Well, if you were running 6 miles every other day and going to the weightlifting gym and now you're told to do nothing, not only are the hormones going to impact, but now you've got this major change to your activity level. And as a female, I certainly know what hormones do when they're just cycling naturally for me, and my hunger and the cues around my appetite and everything change based on where I am. You're definitely going to see that during IVF navigation. So it's important to bring this all to your specific diabetes team and say, what's my best plan of action? How can I, through this stage and then this stage and this stage, make adjustments, right? And what are my targets? What am I aiming for? What is safe? Because again, they're in fertility, while they know diabetes, they don't really know diabetes.
Right.
And they're not going to be the ones that help you understand, what are you targeting? Why are you targeting this? What are we kind of aiming for?
And how to get there. So whether you're using injection therapy or inhaled insulin and injection therapy or inhaled insulin and pump therapy or pump therapy by itself, that is
Yep.
not their specialty. And thankfully, rightfully so, right? Their specialty is with fertility. And that's
Yes.
why having a great team, like you had mentioned before, Jenny, is important. So that's where people like Jenny and I come into the picture.
Hmm.
We help work with clients that are taking injection therapy, and now we need to, starting tomorrow, this is what the plan will be because you're going
Yep.
to do XYZ for your IVF strategy. Or
Hmm.
even pump system. Sometimes I hear, I don't know if you've seen this happen, Jenny, where people will get told, well, you're on an automated insulin delivery system. It will just take care of it. Don't worry too much about it. What do you think about that? Do you see that
It's,
sometimes?
I mean, we both feel the same. It's horrible
It is.
advice, honestly. No
Oh,
matter what AID system you're using, or even if you're not and you're using baseline pumping, I've even heard people kind of get told, well, just use manual mode
right.
instead of using, because at least there nothing is adjusting. Well, then you have no help at all in the picture.
All you, all the
Right.
time, right.
Yes. Yeah.
Yeah,
So it's horrible advice to suggest that something that is either adapting to needs, but does it, all the adaptive systems do it in a slow, gradual process. It's not as immediate as these hormones are going to hit when you start using them. Nothing is going to get you there. You have to have a strong team that directs you in, once we do this, you're going to see this, and we're going to adjust by doing this. There
Yeah.
have to be some strategies.
Yeah. Agreed. Agreed. Otherwise, it's just waiting for frustrating blood sugars that are not
Correct.
the target that you need for a healthy pregnancy. That's what you can expect. And so
Right.
having that information ahead of time, then if it's not part of someone's plan,
Hmm.
then now they know it's really important. We just talked about it and they can go and just like you, most women who are doing IVF are forward thinking because they're not looking to be pregnant today. They're looking over a time period. And so
Yeah.
this just sort of folds into that planning, those planning skills that they're already using to look
Yep.
ahead and say, okay, this is where I'm at now. And on such and such date, I will begin this. What does my insulin need look like then? What do we anticipate? Okay.
Hmm.
What
And
do we,
that's that pre-time period, even those women who are not in need of IVF or don't know that they might be yet, right? That are just in a preconception planning time period.
Mhm.
This is the place where better to start the conversation early in those who are of an age where conception could be possible so that they know how to prepare, right? It's
Yeah.
helping them to tighten as much as possible in a safe way their targets and what to start to watch for and how to, with tighter targets, still keep low blood sugars as much out of the picture as possible, right? It's really
Yeah.
just to optimize your normal day to day before you even get to the stages of now it's time to like stimulate your body to do something or to tell it to hold off on something until we give it another hormone to tell it to do something and then we give it more hormones.
And
Like it all gets like wrapped up.
I think for me, having clients feel comfortable coming forward and getting the help they need, it's just super rewarding because
Hmm.
it can be done. It is done. We see it all the time, and being able to share what we know to
Hmm.
help people do really well with all of the steps along the way is it's just like I said, it's such a privilege to get to help
Hmm.
people through this instead of having them have to do all this on their own or with sort of the intermittent hit or miss conversations with what their usual standard of care is with their diabetes management team that they normally work with outside of trying to conceive in pregnancy. This is
Right.
a different this is a different type of frequency and sort of intensity, and it needs the time allotted to it to make wise choices and really let us look at data and see what
Hmm.
that individual's experience is showing and how the
Hmm.
data is shifting so that a proper insulin adjustment can be done rapidly when it's needed.
Right. And I think everybody appreciates whether you're this type of learner or that type of learner, you appreciate a plan of care
Yeah.
so that you have an idea of who to go to for this and what am I to expect is going to happen. And if I see this, what is my action before I can talk to my clinician? Do I have a step to navigate this? Because it then provides you a sense of in what you're doing is going to allow conception to happen and for it to be an ongoing, yes, I'm definitely pregnant and nothing is being navigated incorrectly, right? I've
Yeah.
started at a base that's really sound and I've adjusted and made changes. I've been able to keep things in the target that's been defined. I think a plan also always makes you feel a little bit more comfort mentally
Hmm.
rather than being sort of thrown into a mix and trying to find the tools at that time that are going to work the best.
Agreed. Agreed.
Think Like a Pancreas, the podcast, is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation.
What do you think about this? Is something I see often where somebody is working really hard at their diabetes management and they have sort of mastered what they need to do without IVF therapy
Hmm.
hormones being a part of, or medications being a part of their day to day. And they come in and they have an appointment because now they're starting and the glucoses are moving around different than normal, but they have all this data, right? Like, do you find often that you have clients that feel some sort of, it's a misplaced guilt or misplaced sense of responsibility that they should have it all figured out by now and that they're doing
Yeah.
something wrong or that they're going to
Hmm.
impair their ability to get pregnant due to some kind of deficit or lack on their
Right.
part because they have all the data, right? Like they
Yes.
have all the graphs, they have all the sensor stuff, they have all the pump info. They should be able to just figure it out.
Right. And that, again, it kind of goes back to, had they been prepared with somebody telling them what to expect to happen. Those who are truly prepared, they've tested all their settings and they've got everything nailed down. And they've even been eating the same two breakfasts for
Yeah.
like 2 months because they work and they've got it nailed. And now, as soon as they start all of the IVF and the hormones, it all looks like it sort of got thrown up in the air and the pieces that fall down are no longer in order. And the frustration comes in again because they hadn't been told well
Right.
enough that this was really going to happen. And then we often, again, lovely, we have a chance to step in with some women at the right point to be able to kind of let them take a breath and
Yes.
express the frustration and be able to say, you know what, you're not doing anything wrong. Look at your data prior. You
Yep.
clearly knew what you were doing. You had it all down to a T. Now what we have to navigate in is, what hormones are there? When do you take them? What are you doing activity wise? We may need to pick and pull a
Hmm.
little bit, and then they have to kind of find a comfort with making adjustments to something that clearly had been working and maybe just isn't right now.
Right.
And again, sometimes if you're more the type A and you've got it all figured out, I think that's really hard to sort of do things a little bit willy-nilly and jumble up the box.
Yes, right? Especially if you, speaking from experience, are a bit type A, that would be
Yeah.
me,
Yes.
especially
I'm right
diabetes
there with you.
in pregnancy, right? Like you want to do all the things. You do not want to mess this up. Like you
Right.
have this, it's normal to have this internalized pressure. And this idea about doing everything perfectly, which is an unfortunate thing because, fortunately or unfortunately, there is no such thing as perfect.
No.
You could be the smartest person on the planet, and your glucose is still going to vary sometimes.
Mhm.
And the change, even without IVF, like there's still going to be out of target glucoses during
Mhm.
pregnancy, even if you're doing all the things. And I think understanding that as an expectation, not that
Mhm.
you just say, forget it, there's nothing that can be done. My glucose is just going to do what it does, so I shouldn't even try. Not that, right? We're not going off the rails here. We're just saying being able to give yourself some grace, to breathe through it, to understand those glucose fluctuations as a normal expectation of going through the process. And that the next step then, instead of beating yourself up about eating a little extra salmon at supper instead of
Right.
like whatever thing you might pick on yourself about,
Right.
of that is, what's the strategy? How do I
Mhm.
get my numbers in target? Is this a pattern? What should be adjusted? That's
Right.
the process and the flow, and getting more and more comfortable with that kind of ongoing changing insulin needs. That is a
Mhm.
skill and it takes some practice, and it is not a natural feeling. It doesn't
No.
make anyone feel warm and fuzzy at first. It's one of those it's one of those pieces that I work with a lot of women on or with, to just lean into the fact that it's going to change. That
Mhm.
those are still healthy breakfasts. You should still eat them. Let's see what we can do for a strategy to help get your glucose in target when you eat that healthy breakfast again.
Right.
That's the focus, not you must bend your whole life around these numbers and make it fit, make it
Mhm.
work, or you're failing. None of that stuff fits into healthy pregnancy and during the IVF process or not. It's a struggle.
I think something that fits into that is also the struggle with, while this also goes into pregnancy in that early time period of IVF, your early weeks of planning, and then you go into kind of whatever hormones are in use. What the plan is it stimulation? Are you kind of waiting for the next phase to get pushed in? It's the insulin change. And for those who are more planners, it's nice to have an idea of what can I expect in each of these different stages. I had somebody who actually was lovely, came to me with all the documentation, preconception, was planning, knew IVF was going to happen at this point. It was like 3 months down the road, and we were planning and had all of the hormones, like outlined guide. This is when this, in this time period, and then this is, that was helpful because her insulin needs were very low to begin with.
Yep.
So from an explanation standpoint, we always, you and I both talk to women about the expectation of insulin climbing through the course of pregnancy. You get here and then you get more and then you need a lot more. And then it looks like you're just taking the whole bottle of insulin at some point.
Yeah.
But that can happen in IVF as well. And I think that's something to get your mind wrapped around when you're only using this much and all of a sudden you're taking double the dose of insulin to cover, as you said, it's the same breakfast. We just have to have a different strategy for, and it likely means in each stage a different change in the dose of insulin.
Yep.
You might see early on, you might see more post-meal spikes where your basal insulin might not need to change at all. It might be more daytime food specific.
Mhm.
Again, each stage, it's nice to be able to guide somebody and say, expect this and expect your ratios to change here and expect them to kind of fall back here because the hormones get pulled back a little bit. And I think that helps to reduce some of the anxiety about preparing people for what they're going to see. Nobody really likes to say, well, my insulin to carb ratio is a 1:16 and it looks like I need double that now. Well, you know what? The data shows it. So let's use that. It's a
Okay. That
mind trick.
means
It's
it's
yeah.
and it can be alarming if you're trying to figure it out on your own. And
Yes.
even with someone, sometimes
Yes.
I'll get an email back from somebody saying, I'm just double checking, right? I know the math is there. I see it, but I'm just double checking. This is what I'm planning, right? These are my settings today, right? Like
Yep.
that's sure? Yes, right?
Yep.
Because it's different than normal.
It is.
I've seen it referred to as high demand season. I think that's a nice way to think of it because it's all a stage of transitioning, but
Yes.
it's not a permanent, like this intensity and the amount of changes that a woman is going to go through, who's going through IVF. It's a, in theory, a finite time period of,
Yeah. It's momentary, really.
yep. And then this is the process. And then if there is successful implantation, there is a pregnancy behind that thing. So if you look at it as a, okay, it's a 3-month window that we're looking at for this person's planned IVF process
Mhm.
or however long it is fluctuating, it is challenging, emotionally, it's a toll emotionally. All of those things are real. And it's not forever. And I
Right.
think sometimes just being able to look at it from that perspective, like this is hard and you can do it, is helpful because
Yeah.
otherwise feeling like it's just never ending forever. I'm going to have to deal with it this way. That's a lot. That's too much and it's not real.
Right. So many changes. I think it's the big thing when you're considering any of this hormone, like you're playing with hormones, really,
In a
right?
structured way. Yeah.
In a structured way, but we're still putting them into a body in a way that you've never had the ability to see the action before.
Right.
Especially, many women who come for IVF are often those who don't have regular cycles to begin with.
Correct.
So, that's a hallmark of when we have a chance to work with women preconception, we're really working on navigating what are your needs through the different cycles of your month, right? Or your cycle time.
Right.
Needs go up, needs go down, needs go up weirdly, and then they come back down and then they go up again. But if you have no structured visible to what your body was doing, now you're coming into IVF without much knowledge of what those hormones were doing because they were disrupted to begin with in your body.
True.
kind of at a baseline of unknown to begin with, which
right?
is
True.
hard.
Yep. That's a good perspective, I think, for some women who have very strong differences in or pronounced differences in their insulin needs throughout the cycles. Then when their IVF team says, okay, we're gonna do progesterone and an estrogen starting from this date to that date, it's not a foreign language. There'll be some already pre-existing expectations and understandings of what that likely will do to conceptually likely due to insulin resistance
Right.
and needs versus somebody who's just new to the whole how how reproductive hormones impact diabetes just in general. That's a good point, Jenny.
Correct. If there were some hallmark kind of takeaways, sort of pearls to
Mhm.
sort of hold on to and kind of grasp from all of this, what do you think you'd start with?
I think it would be leaning into and expecting there to be changes in insulin therapy. That is going to be a need.
Hmm.
And I would say planning ahead to work with your teams, IVF team, diabetes team. And if you don't have support, in your heart of hearts, you don't have the support you need, then find it if you can. If you have access to it, reach out and get scheduled with someone who can help you navigate it because
Right.
you're worth it.
Yeah. I think too, as a clinical team, even bringing, I mean, there are many podcasts, right? And there are many podcasts that have different information, even if they're not specific to diabetes, maybe specific to IVF or fertility treatment and that kind of stuff. And I think sometimes it's also helpful if you actually bring to your team
Mhm.
something for them to hear that you got something from, that you took something away from, and you think that it will help them to navigate with you better. So, if there's something that we can help with, I know when we have the opportunity to work with women, we are very happy to communicate, write letters, even call the doctor's office to say, hey, we're working on this and this is how we've been navigating this.
Yeah,
So I think that's valuable information to make sure that your team is all on board.
agreed. Yeah. As a final thought from me anyway, just prepping for pregnancy, IVF therapy, pregnancy itself, it's all dynamic. And
Yes.
rightfully so, right? The practice
Right.
of growing a human being, it's amazing, and the
Yeah.
body goes through so much to make that happen. So it rightfully so, it makes sense that insulin therapy is going to change throughout that whole dynamic time period. So
Yes.
and it's okay to want and need extra support above and beyond maybe what were given in your first appointments with your teams,
Right.
because especially with insulin requiring diabetes, you're in your own ballpark, so to speak. You're not by yourself, right? There are a team of or other even if it's not your care team, there are other women out there who are also going through it, have gone through it, will be going through it. You're not by yourself. But
Right.
getting the support you need is extremely important to doing what you can do to your best ability to have
Hmm.
a healthy pregnancy, which is the end goal here for this
Right.
discussion. And
Yeah.
so it's totally okay to ask for extra support.
Hmm. And that's, where we certainly are happy to come in is to add that extra hand holding. You've got a team that can help you navigate in general with your diabetes, but really doesn't do too much outside or can't step in between visits and help you look at your data or navigate some of this. We're really honestly, in a good way, skilled at knowing how to help people transition through, even giving strategies to say, well, it may be more beneficial while you don't really usually do it this way. Let's try it this way for this time period. And,
Yeah.
our hand holding is a kind of a special kind of hand holding. It's really a privilege to get to work with women who are bringing another new little person into the world. So it's lovely. And we would love to be able to help and explain a little bit more, give more strategic navigation as you move through each of the stages of IVF training. So, integrated diabetes services might be it'd be a great number to keep on back of your phone. So anyway, thank you very much. Anything else you wanted to add, Tavia?
Just that it's been lovely talking with you, Jenny. It always
You
is. And I think it's just amazing that I get to work with such an amazing team, including you, of course.
I feel the
So
same. Absolutely. Yeah. So thank you very much. And I hope you listen to all of our episodes. We've got a little bit of great tidbit in each and every one from all of our clinicians and even other colleagues we get a chance to talk to. So thanks for joining today.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. On behalf of Think Like a Pancreas, the podcast, I'm Gary Shiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.